it's rightly said that medicine can cure a patient, but when it comes about the patient's heart and the soul, then a great doctor can only heal that. So today I'm here in New Lotus Medical Center, which is situated in the heart of Dubai, Kisses Damascus Street, as you all know. And here I am honorably welcoming the doctor who has completed almost 8 years in this field. She started in India and reached here, Dr. Soumya Harikumar. When I was talking to her, it was her passion to become a doctor. That's how she reached here, with the heart desire to serve people, to serve patients who are in pain. She is a gynecologist by profession, so I'm here to talk a lot about women health and what all lifestyle diseases we are facing nowadays in this era, and also how many other things are there in these hospitals. So I hope it will be a healthy discussion as well. So before we start this Saflami Yatra episode, I would like to welcome Dr. Soumya Harikumar to the episode. Hello, ma'am. How are you doing today?
I'm good.
I know you have a very hectic schedule and a lot of patients are already waiting there, but thank you so much for your time. So without wasting our more time, I would like to begin from the time. How come you chose to become a doctor, or how come you chose this specialization, that is gynecology?
Because when I started, I did have the idea of being a doctor probably from school. I always wanted to take up MBBS because I wanted to do gynecology. Concept of giving, help to mothers to deliver a baby was always fascinating. So I chose gynecology. I never had another option.
Yes.
It was always gynecology.
This was the only first and last option you
Yeah.
had. And you studied in Trivandrum.
Yes, Gokula Medical College.
And after that, how your career started in Trivandrum or which part of India?
No, I actually did my MBBS from Trivandrum and followed by post-graduation in Karnataka, in K.S. Hegde Medical College, which is located in Mangalore. Followed by my residency in Alleppey Medical College, TAD Alleppey. And then I did my 3 years post that in Pushpagiri Medical College. So it was almost 3 to 4 years in India, and I must say that I was quite lucky to work with quite renowned doctors. Even if it was Alleppey also, my HOD was quite a well-known doctor called as Lalitambika, Dr. Lalitambika. She's quite well-known. And then followed by that, Pushpagiri was another very famous doctor. She was an ex-HOD from Kozhikode Medical College, Dr. Sridevi. Okay. She also happens to be my father's first cousin. So I got the great opportunity to work under her for about 3 years. But after that, COVID struck, and I never had the plan to leave India, to be very frank. But my child was very small. He was only 6 months old. Quarantine was taking a lot of, because I was stuck in the hospital for a long period of time. My mom couldn't manage. My mom and me were stuck in Kerala. My sister is a pulmonologist by profession. Though she's practicing, she's not practicing now, she's into business with my father. So she was stuck in Mangalore because she was a pulmonology resident that time, and she was, actively working for COVID at that point of time. So, sometimes life doesn't go the way you plan. So we had to move because my father was stuck in Dubai. So we never wanted to stay apart. So we took the collective decision to come to Dubai at that 4 years back. Now here we are.
So just to conclude, Dubai was never on your book?
Practice-wise, never on my, because I always prefer to practice in India. Even my husband, but then sometimes, you do things for your family, your child, what is better for them. And COVID was a decision-making point for us.
So this is how you came to Dubai, and after work?
I can't say I was brought up entirely in Dubai. Yeah. Dubai is home for me. There's no doubt about it. But yeah, when practice started, I didn't have the plan to leave Kerala, to be very frank. But then Dubai is always home. I was entirely raised in Dubai and Saudi. I did my schooling entirely till 12th standard in Dubai. So Dubai is always home. But yes.
Before talking more about New Lotus Medical Center, which you have joined like 3 months back, I mean, you have acquired it, I would like to ask a few questions about the women health.
Alright.
Because we are in the part of world which the life is very busy here, stressful life, all are working, mothers are working, young ladies are working, a lot of stress. So what are the lifestyle diseases which are commonly seen here, and what are the things we can just take precautions, or we can do a few things or changes in our lifestyle so we can stay away of it?
Yeah, that's actually something that is not quite unknown. Actually, people, because of social media, they do have, let me be very frank, not a complete idea, because I think social media is making people more confused these days. But polycystic ovaries becomes one of the most prominent health issue that is affecting a child as young as 10-year-old. Even, you find children who just attained menarche, that means the first time periods, following which they never have a proper cycle, and they are diagnosed with, it was called PCOD before, now it's called PCOS, it's become a syndrome. That's one of the most commonest lifestyle problem, and followed by other things like infertility and obesity, and which is giving rise to early development of hypertension and diabetes. But I think things will change, because now people are more conscious about obesity. People are into weight loss drugs like Mounjaro and all that. So, but I'm not saying that is definitely the management, but drugs are always this one. People are aware of drugs now, so I think.
So according to you, doctor, what is the right age, or from what age a girl should start consulting a gynecologist?
Well, see, depends. A gynecologist per se, most of the time we encounter a woman when they are in their reproductive age group, right? But that it's not limited to that, because we have these issues like PCOS starting as early as school-going child. I have treated PCOS from as early as 11-year-old. You have children who have already got their periods, following which they don't get, and then when you evaluate their hormones, it might be deranged. I have children who have never gotten periods for, like, they're 16 and 15 and all that, and some of them have not attained menarche. That means periods, the first period. So as early as school-going children are being seen by gynecologists. Sometimes they do present with excessive hair on, facial hair, acne. So dermatologists might see them first and then refer. So PCOS always is one of the first things that comes. And of course, the knowledge about cervical cancer and therefore the injections like Cervarix and Gardasil, which is given to prevent HPV infections, is given for young children, young girls and boys. So even those kids do come and consult a gynecologist for taking the vaccination. But as far as age is concerned, we go up to menopause, so it's quite.
So just as an information, there are so many tests like nowadays we come to see through so many social media posts or some doctors' interviews that breast cancer checkup or pap smear, these are the few things you should continuously do in 6 months. So just doctor, why this was not there before, but now the cases are increasing. So is there anything from which we can prevent?
Actually, you cannot say it is increasing. You can say that screening has gotten better. We are detecting things earlier. Just like you will find a lot of people dying of cardiac arrest all of a sudden. That's probably because the reporting of through social media and your might be there before as well. But now your media is so strong that every case is being reported. Similarly, screening has improved a lot. Now women are aware about their health. Women are getting their health checked, their blood test done, their BP monitored, they're getting their pap smear done, they're getting breast examination done by doctors, or they're doing a self breast examination every month. And thanks to even if you notice, if you are interviewing me now, how many doctors would have interviewed regularly maybe 10 years back? So now, since social media and your TV or whatever form of media you have, doctors are more prone to talk about it. So because of that, people are more aware about it. So you have both sides, right? Because of the screening, you are finding out that there are more issues. You're finding it at much earlier stage. So the cure rates are better. So this is how you, even if you are talking about breast cancer or if you're talking about pap smear, like your cervical cancer, they're all screened now.
Yeah.
So I have women regularly who come to me and they do get advice. Before, the concept of hormone replacement therapy, which is usually given for menopause, was not very widespread in India. It was very active in the Western countries, but it was not very active in India. But thanks to the media, now women are aware that they can have a good life even after attaining menopause. They can have a fruitful life after attaining menopause. So why not? So you meet a doctor at that point of time and get information about it. Yeah.
Now, as we can see, the technologies, the AI is all over the world, all over, in all the industries it's there. So basically in medical industry also, we have implemented a lot of AI uses here. So in gynecology or in this, in this specialization of hospitals, how come AI is helping?
See, AI is something that would is the future. Right now, if you take into consideration the Arab Health Week that happened in Dubai this year, had a major segment covering AI. Your ultrasound machines are incorporated with AI, which makes your imaging much better. I think, see, I would want a future where both AI and human beings go hand in hand, rather one taking over the other, because human expertise is human expertise, right? Every human body is different. AI works on algorithm. Yeah. Okay, so it is still something that we have to look forward. It is our future, no doubt about it, because now laparoscopy age is over. We are into robotics. Yeah. So robotics is doing, doctors are into robotics and they're doing wonderful cases. We have great surgical results. The hospital stay has reduced a lot. The post-operative care, the time for recovery has reduced a lot because of robotics. So of course, AI is the future, but I don't know if it will completely take over human expertise. That is something that we should be worried about also, to a great extent. Yeah. But yes, it is our future.
But if it is going hand in hand, so
why not? Why not? Because precision is something that algorithm can give you. Human errors will be reduced to a great extent when there is AI. So even though the saying goes that to err is human, to forgive is divine, that doesn't you cannot practice when it comes to healthcare. So
and also we are from India, so we from childhood only, we being girls, we have heard a lot of misconceptions, and not only that, so many myths about women health or women's reproductive health. So what would you like to say about it? Nowadays awareness is there, so it's less, but what would you like to say about it?
You mean the myths as in?
Myths as in like about are getting pregnant, if you're on periods, you're not supposed to do certain things. What would you like to say about it?
See, I'm from a cultural point of view, there might be so many things that is actually true, right? But there are so many myths also that cannot be accepted. But then there are certain things that you shouldn't question. So I believe in don't question your grandmas, let it be.
And being a doctor, what is the best reward you have got? I'm not talking about any award or anything, materialistic. But being a doctor, there are situations when you face certain challenges that you will always remember in your life. In the same way, what rewards you have?
See, actually, when you come to a career-wise, I'm still a very, very young, as in very young to the field of medicine, right? It's been only 8 years post-graduation. But I think when any patient, so as a gynecologist, I think the most rewarding thing is when you give the patient the experience of motherhood, when you treat a patient for infertility specifically, and they come back to show you their baby. I think that is most rewarding for me. When career-wise, I like more of obstetrics than gynecological part of my field. I am specialized in laparoscopy, but even then I like my obstetrics, because as I said, gynecology was taken up because of that part. So when you make a patient pregnant with infertility treatment. I'm not an infertility specialist, but our basic infertility treatment do work sometime. I mean, most of the time, thanks to God. So when they come back with a baby, yes, that's one of the biggest rewards as a doctor you can give. I don't think Google review will have that much power.
So this is the best reward you would say in your life. So I would also like to talk about New Lotus Medical Center. Like you were working with another clinic here in Dubai for almost 3 to 4 years, and then you decided to acquire this. How come that idea came up, and what all doctors are present here at present, so that people can just come and have
why not? Because at the end of the day, you should talk about your. This is actually something that has been a passion, because healthcare. My father is my mentor. Let me be very frank. I'm sure everybody knows him. His name is R. Harikumar. He's the managing director of Allied Group of Companies. So keeping all that aside, I think he has always told me that not only me, anybody who has taken up medicine, me, my sister, my husband, her husband, that never practice medicine to make money. There are other means to make money, but when you're practicing medicine, don't think about making money. So, and this is a thing that he has always told us, because we were always told not to become doctors. Let me be very frank, because I come from a business background, and everybody, any relative, be it anybody, said, why you want to go for all this? Even my professors has told me, Swami, you could have actually, why you, this much hectic job, why you want to, but then my father is someone who never stops us two girls from doing whatever we have wanted to do. So this is my baby. This concept is my baby, and I like to give my 100% when I'm with my patient. And I think I can vouch for the fact that 4 years I've practiced in Dubai, or my patients, if they find, if you find my patient, they'll tell you that I talk to them, I listen to them. So I think that is what every doctor should do. If you are able to listen to a patient, you will get, because at this point of time, what people lack in this current fast-paced life is there is nobody to talk to. So if you're spending your time one day and you're seeing more number of patients and you're not able to talk to them, I think you're failed as a doctor. If you're seeing 100 patients, that is not something that you should brag about. I think if you're seeing 100 patients, then you have to sit the whole day in a clinic. That is not possible. Yeah. So if you're seeing limited number of patients also, spend time with them, listen to them so that you are able to process what their problem is. If you're not able to listen to them, if you're not able to give your thoughts into that process or that conversation, I think you're failed as a doctor. And in Dubai especially, because you know the work culture here, it is a very amazing country. It is supportive to all our career goals. But when it comes to, you know, that stress factor, I think it is more here. And that's why you find young girls, you to ask me a question in the beginning, there are so many young girls who are single, who's coming to Dubai, who are having a lot of health issues, to be very frank. As early as 21, 22, I do get a lot of patients who are not aware about what to do. And then you have a lot of couples who are facing with infertility. And the worst part is there is no reason for this infertility. Before there was a reason. Girl had this problem or boy had this problem. And now you have unexplained infertility cases, and which becomes more difficult for us to treat. So stress factor becomes one of the major reasons for that. So I think a doctor's role comes there, where you're not there just to give them medications, but you're able to talk to them. And then,
are you also giving counseling to the patients?
As part of it's part of your job. I'm not trained to counsel anybody, but it's part of your job.
Beside the gynecology, who all medical experts are here in New Lotus Medical Center?
We have 4 GPs currently. We have an ENT doctor who is joining next month. We have an orthopedician who's got a good practice here. We do have a dermatologist. We have a physiotherapist.
So people can come easily here.
Yeah, we have all the major specialties. And we have an internal physician coming in September. Yeah, he's quite senior, so yeah.
You would like to see your baby grow?
I hope so. I hope so.
Yeah, it will be, because the passion you have for your job and what your dad taught you, it's not to make money, but it's your passion, and you have to serve people. So, as you were talking about your dad, how your parents have influenced you, because you have seen your dad from the very childhood. He was into business, and your mom was also there, and I think she's also part of business. So your two daughters, how was their influence, how they brought you in such a good way that today also you have that things in your mind?
For me, everything is my parents. There is nothing, I mean, God, of course, but my parents. First,
eldest daughter.
I am the eldest daughter. My mom has devoted her entire life, even now, for her kids and her grandkids now. So I think she's a role model for, every woman. She is, I mean, women should not be made to, and she's a very passionate woman. To be very frank, she is very passionate. She loves dancing. She likes all kinds of art forms. So she is a woman who saw all those passions through us.
Okay.
She taught us dance. I mean, she sent us for dance classes from a very young age. I started dancing before I went to school. So, and we are both very professional dancers. We are trained. We are still training now. So, I think I think 10th standard, 12th standard, and all. She sat with me throughout my exams, and she's done everything. That level of dedication as a mother. Now she's behind our kids. She's doing the same kind of thing because if my mom or my dad is not supportive of, if our husbands are not supportive, women cannot, we should be very open about that. Yeah, talking about feminism and everything, but I think you need a strong support system. And father is, every ideologies I have in life, or every ideology my sister. Now, if I say every ideology our husbands have also, is from, to a great extent, influenced by my father. He has certain things that he also is that kind of a person that says that when you make a certain amount of money, you stop. Mm-hmm. Then you give. Yeah. Otherwise, that cycle will.
And after getting married, another person comes into life, that is your husband. He's also a doctor.
He is an emergency physician.
He's here in Dubai as well.
He's working with Dubai, London, in Jumeirah.
Okay, what's his name?
Dr. Murali Raj.
Okay, what would you like to say about Dr. Murali as a husband?
That's what I'm saying. If you don't have a support system, this, as a husband, I think what every couple should realize is that nothing is going to be rosy all the time. As a part of being a gynecologist, I do, when infertility problems happen, most of the time they do come and talk about their personal life, and that's part of our job. So what I have found out is that there's a lot of expectations from the husband, to the wife, and wife. There's expectations are so much, and that is mainly coming from your social media. I feel my friend her husband did that. Why can't I have that? Or my wife, or my friend's wife has done that. Why? See, this is very individualistic. Yeah, think about what you have to understand is that if he is there for your growth, if you're starting in a relationship, that's the problem. You don't have to work all the time as a female. You can choose not to work. You can choose to work. But if he's supporting you for both the decisions, that's a good relationship. I feel that when you expect too much out of anything, it ruins it. And I might get backfired, because I think this is going somewhere on YouTube or wherever. This is my personal opinion. I feel that if you are there for his growth, he's supporting your growth. Both of you are able to take care of your child if you choose to have a child. Now, let me be very. If you choose to have a child, if you are there for that, you are successful.
That is what
I feel that is enough, because if I am able to sit here at 6:45, my husband is there with my child.
This is something we can be happy about in our lives. Right. And all through your life, I think you were born and raised in Saudi, then you moved in Dubai.
No, I was there in Saudi till about 5 years, and then
So most of your life was in Middle East, and still again you're back to Middle East. Yeah. So basically in UAE, especially I'll talk about you as we are here in Dubai, most of the people are from different countries. Almost 200 nationalities are here. But we should salute the government of Dubai, government of UAE, the sheikhs, their vision and how they support us. So being an Indian citizen, living here in Dubai, what would you like to say about the government of UAE?
As I said, it is my home. I mean, I'm proud Indian. I love my country. I would still go back to India, but Dubai is just equally good. And Dubai is it's a platform which has given a bright future for so many people.
Easy access to bright.
It's not about easy access. Also, they are so welcoming, don't you think? Exactly. They have opened their country for all the nationalities.
Yeah.
Sometimes I feel that for us, no offense, but sometimes an Indian finds it difficult to start a business in India.
Yeah.
Have you experienced any? If you have the potential, if you have the resources, I think Dubai is such an open land for everybody. I'm sitting here and talking to you about a clinic which is owned by my father, and so I'm able to sit here, right? And I think they are so welcoming. Yeah. They are so welcoming. They are so, I think, supportive to all kind of nationalities.
We are sitting here doing what we want.
What you want, and you're feeling protected also.
Protected also. This is one of the best examples which we can say about them.
Women's safety.
Yeah.
You can walk around Dubai anytime. I think that is one of the biggest plus point that this country has. I've worked till 10:30, 11 in the last 4 years. I've never reached home before 10:30, most of the days. I drive alone. I walk alone. No problem.
So being a doctor, usually we ask this question to entrepreneurs like, what is the success mantra of your life? But being a doctor, what is the, what mantra, what health mantra you would like to give to all the ladies or all the people over here?
Do what you feel is good for your body.
Okay, there is no set, because everybody has a different language, as we say.
Yeah. I always tell my patients, when you're having dosa or idli in the morning with sambar or chutney, and then you're actually on Instagram scrolling through your influencers, and if your influencer is having avocado on toast, don't think that is your forte or that is what you should follow. Being an Indian, probably your morning breakfast should be idli and dosa, but make it more healthier. That's
exactly. So many keto diets and OMADs. I don't know what all there.
I'm not someone who follow. I would not tell any of my patients to follow any of these diets. I think a good Indian diet with good amount of protein. What we sometimes lack is protein. When you don't have enough protein, you tend to not have a great, But then otherwise, I think we are good enough.
If I talk about from the beginning, you're talking about the passion, but other than this, what is your hobby, or there's anything else? As your sister chose to be in father's business, it's her decision and we respect that. But you chose to be this. Is there anything else which we would be saying in the future, or you have in mind, okay, once I get my time or retirement, I'll go for that?
Retirement. Yeah, there is a...
It's a long journey. I'm going too far. But sometimes, you feel like, okay, now I should step out and look at this. As you're a dancer as well. Yeah. So, what is that?
See, dancing is something that is always there. It's never parcel of... It's a passion that will never die. I don't believe in retiring. Yeah. I think there also my father... There's a book called Ikigai. Have you read it? I don't know if you've read it. There's a book called Ikigai. It's... Japanese. They have this system that even if you retire from your actual, do something that gives you happiness. I think traveling.
Okay.
I like to see. It's not about traveling, but I like to see places. I like to see different cultures. I like to eat food. I like to spend time with my family.
All the life being a doctor and then working in different hospital and now working in your own hospital, which is owned by your dad. Have you ever felt that kind of pressure, or okay, this is a challenge which I'm gonna take, or that risk is there? Anytime you got that idea in your mind?
It's a new concept for me. I've never worked I've always worked for someone. In spite of my dad being, I've never worked in a business. I've always worked for someone. I was always an employee. So this is definitely a new, I would not call it as a risk, because everything has its own risk. I'm someone who believes that let's see how it goes. If I don't have that belief, then I don't think I'll reach anywhere. So I hope for the best. I'll see what I can do to the best of my capabilities. I'll do my 100%. I'll make sure people around me are comfortable working with me. I think that's most important. If you don't create an atmosphere where people want to be working with you, I don't think this is going to be a success. So make an atmosphere that is good for all your employees. Treat them with respect. Don't act like you are the king of the I think you don't have to act. If you are good enough, they will consider you. So give them the atmosphere, make them feel at home, and I think the rest, they will do the best.
So lastly, I would like to ask one more question. What message you would like to convey for the youngsters? And so many people are watching. So what message in this era you would like to convey for them? It's not only related to the health, anything which you feel has driven your life all these years, or any success mantra, if you have anything you can share.
I think one thing that I want to tell about, success only comes with hard work. And sometimes it is good to think about others. I think nowadays the generation is being brought up in such a way, it's always self-love. I agree, you have to give, but equally it is important to consider others. It's equally important not to be selfish. It is equally important to love others and to respect others. That is something I feel is lacking.
Thank you so much, doctor, and for your time and for the informations which you have provided, and for the passion, the enlightening passion which I saw in you, and my audience will definitely see that. It was great talking to you, doctor, and in your this hectic schedule. Thank you so much. We wish you all the very best, and all the very best to this new venture which you have acquired. We would like to see it growing, branches coming, so that I can come again and take you to another branch.
I hope so.
Yeah. Thank you, doctor.
Thank you so much. Thank you.